First speaker is Eunice. She is the nurse practitioner with the ACHD program here at Methodist and works very closely with Dr. Lin. She is going to talk to us about transitioning from your pediatrician to an adult cardiologist.
Thank you. Thank you, Akansha. And I want to say it's a great honor to speak today and to speak to patients and care providers, and to also give you a little bit of my experiences in the clinic, as I have seen many of the patients transition to the adult clinic. So I have no disclosures. So our objectives for today is to understand the transitional process, also to understand why we advocate for transitional care, and to also outline the goals for transitional programs. So I copied this out of the most recent 2018 AHA-ACC guidelines. And what it says is recommendations for transition education. Clinicians typically caring for congenital heart disease patients should deliver developmentally appropriate transition education to adolescents and young patients with CHD and to their families. So with that said, I wanted to give you a brief overview of a case presentation of typical patients we see in the clinic. So this is a young gentleman who is 21 years old, and he's in college. He last saw his pediatric cardiologist about 5 years ago, and he relocated to a small town where he goes to college. He has not seen a PCP since he transferred. And now he is complaining of feeling very dizzy, and he's also having palpitations. And this has been going on for about a month. So he knows he has had surgical correction of some heart disease, but he's not aware of the details. And he does not have any medical history or medical records with him. So what are some of the concerns we would have as providers in the ER? These are new symptoms on a very young patient with prior surgical history. They've been going on for about a month long, so obviously it's something that needs to be taken care of right away. He has not had recent follow-up, and he has no unknown surgical history as well as no medical records for review. So as a provider, our greatest challenges are to, number one, give them the appropriate type of triage to mitigate the issues they have at that moment to make sure they're clinically stable. The other concern is they could have a major cardiac event because we don't know of their surgical history or their medical background. Now, in the back of the mind of any provider is to think, what do I need to do next to provide the best care for this patient? Because it's a small center, no CHD specialist, the goal is to transfer this patient to a higher level of care. Oh, take that back. There's a lot of communication gap because we don't know what the patient has had, and we don't know what could be causing the patient to have these symptoms. And obviously, this would cause a delay of care ultimately because we're trying to figure out what to do with a patient. So what is transitional care? It's not the same as transfer of care. Some of us would just assume you take your medical records from your pediatrician and you take them to the adult cardiologist, and that is considered transition of care. But that's not quite true. This is a gradual process that begins in the pediatric clinic and continues on into the adult clinic. Now, some patients who live way out of the major medical centers where there's a CHD provider, we give them the option, or they're given the option of shared care, meaning they have a cardiologist who understands their medical condition, who can take care of their issues before they can transfer to a major medical center or see their cardiologist for their specific congenital heart disease. So why do we advocate for early transition? As you can imagine, a young 12, 13-year-old obviously is overwhelmed with a lot of information about their medical background and their surgical history. So as you start early, you ease their anxiety, as well as you give the patient and the caregivers an opportunity to go through the process of, one day I'm gonna have to move from this clinic to the next. You provide them a medium for continuity of care because it's not a matter of dropping the ball into the next person's hands. Also, this provides for bridging the gap in transition. So there is not such a shock value to the provider, the one oncoming or the one leaving, or even to the patient or their caregivers. And this also helps lessen the loss to follow-up in most of our patients. The ultimate goal for a transitional program or process is to provide uninterrupted healthcare that is patient-centered, age and developmentally appropriate, flexible, and comprehensive. Some of the goals for transitional programs include early adolescence transition. You want to try to start this conversation as early as early teens, 13, 14-year-olds, and it goes on up to about the age of 18, by which we hope the patient is ready to transition. You want to educate the patient on their disease-specific condition, as well as include their surgical catheter-based interventions that have been done to date, and set them up for expectations, for concerns, and things to look forward to in the future, because we know congenital heart disease is palliation. There's no cure. There's a possibility of crisis in the future or changes in their condition, and therefore, you want them to be prepared for what could be coming. Also, to understand how to navigate the healthcare system as an adult. As you get older, we all know we acquire other conditions such as diabetes, hypertension, high cholesterol. We want to get pregnant. We want to start a family. Some of our young men want to lift weights. So these are things that we need to talk with our patients about before we send them to the adult clinic so that they are prepared on what to look forward to. This also encourages self-advocacy. The best advocate for your care is yourself. And as you can imagine, if you've had multiple surgical corrections, had complex cardiac history, it is important for you to know what your diagnosis is, as well as to educate others who may not know how to take care of you. This also empowers our young adults to make decisions. It provides support in the continuum of congenital heart disease care, as well as enhanced care coordination from one clinic to the next, all within multidisciplinary providers such as different specialties. You can imagine if you have a young woman who's trying to get pregnant or is pregnant, you do need a group of providers, including the OB, maternal fetal medicine. You do need the cardiologist, the surgeon. So it is a comprehensive care provision, and that's why goals for transition are very important. So most of you know, one does not simply move from paragraph to paragraph without transitioning. So it is very, very important that we do one thing before we go to the next. And we also want to emphasize that the patient and the care providers are in the forefront of congenital heart disease care. So in summary, transition is conceptualized as a process. It's a shift in responsibility of healthcare. I also want to encourage you all to have a medical passport, or encourage your patient or your son, your child that has congenital heart disease to carry a medical passport or some brief history of their medical condition. You should always have your congenital heart disease specialist contact information, and you should share that with your PCP or any other physician taking care of you. It's very imperative you ensure that you have follow-up as recommended. Some of us can be 1 year, every 2 years, or some it could be as frequent as every 3 months. It's important that you must have a PCP in addition to your congenital specialist. We talked about other acquired conditions such as high blood pressure, such as diabetes, hyperlipidemia, you name it. You do need somebody to oversee those non-cardiac issues. Always know the proximity to your tertiary center should you have any complications or need acute management. Also, there are other resources available for transitional process. If you can't find any providers within your area, there are web-based and networking groups that are available to help you with this transition process. And of course, if you contact a major medical center with a congenital heart specialty program, they will be able to plug you in with the right clinic. Thank you. That's the end of my talk.